Hello, everyone. Please, can you take your seats because we're about to start our next panel discussion. Did you not hear the lovely sting there? And it paused and it stopped, and that was me announcing that we're about to start. So anyway, thank you very much. So we heard yesterday Tetiana Struk's powerful account of working as a translator in Ukraine during the Russian invasion. Well, our next session, Translation and Technology in Crisis Situations, will be delving deeper into the wider challenges translators face and interpreters face during humanitarian crises, when there are wars, natural disasters, and then there's a sudden influx of frightened, hungry, homeless people who cannot speak the local language. Now, I'm going to hand over shortly to Lucio Bagnulo, who's going to chair the panel discussion, but I just wanted to say that we have 3 panelists who are going to be joining us online, and we won't have any online interpretation when those panelists are speaking. My role is not just to introduce the panel, I'm going to come back a little bit later to help Lucio with the Q&A. So as before, please keep putting in your questions as you go along. If you have any thoughts, put them in the Q&A. But I'm going to introduce now Lucio Bagnulo, who's the head of Translation and Language Strategy at Amnesty International, and he's also a member of the Lint Group. Lucio, what does the term crisis translation encompass?
Can you hear me? Yes. Hello, everyone. Well, very good question, and we will dive into that in a couple of minutes. So I won't answer, just to create a bit of suspense.
Thank you, Lucio.
We will address that. So, hello everyone. It is first of all my pleasure and honor to be here today and to be chairing this panel on translation and technology in crisis situations, and to be accompanied by 4 distinguished guests, well, 1 here and 3 online, each of them will touch on, will discuss about their experiences, their perspectives on the importance of multilingualisms in this critical context. So, first of all, I'd like to introduce Professor Federico Federici, who is joining us from Oxford. Federico is Professor of Intercultural Crisis Communication at the Centre for Translation Studies at the University College London in the UK. His research focuses on translators and interpreters as intercultural mediators and the study of translation in crisis. His peer-reviewed articles have appeared in journals such as Translation Spaces and International Journal of Disaster Risk Reduction. And along with Professor Sharon O'Brien, who is with us today as well, he co-edited Translation in Cascading Crisis and Translating Crisis. And by the way, the letter will be publicly available on the 17th of November. He also co-authored reports on crisis communication policies, on multilingual communication in the humanitarian sector, and government briefs. So welcome, Federico. We also have Dr. Gaia Gamewage joining from Geneva. Gaia is a medical doctor and public health expert with 3 decades of experience in the health sector. She worked for the World Health Organization for 21 years, mostly leading initiatives to build institutional capacity for health emergency, for example, providing training on COVID-19. And since 2021, she has been the director for prevention of and response to sexual misconduct. I mean, Gaia has held far too many positions for me to go through them all, but it's suffice to say that she has spearheaded new areas of work for the WHO, including in health and communications and behavioral change, risk communication, community engagement, and most recently, lifelong learning for health, which included developing the first ever WHO global learning strategy for public health. So welcome, Gaia. And we also have, as I was saying, Professor Sharon O'Brien joining from Dublin. Sharon is Professor of Translation Studies at the School of Applied Language and Intercultural Studies at Dublin City University in Ireland, where she teaches many topics like translation technology, research methods, crisis translation, etc. She was coordinator and principal investigator of the EU-funded Project International Network in Crisis Translation, who most of you will know as Interact. And as previously stated, along with Federico, she co-edited 2 books on translation in crisis settings. And she is currently the Associate Dean for Research of the Faculty of Humanities and Social Science. And welcome, Sharon. And last but not least, I've got here I've got the pleasure to have here Stella Hodgkin-Paris. Stella is a versatile language service industry expert with a passion for languages and a belief in the power of global communication as a driver for change. With over 20 years of experience in the language services, she's currently a member of the leadership team at Clear Global Translators Without Borders. And as Chief Language Services Officer, Stella seeks to leverage the potential of TWB's community-based model to provide non-governmental organization partners and UN agencies with essential language services and support. Welcome, Stella. So, such an exciting panel, but before diving into the discussion, I'd like to officially kick off our panel with a video that will certainly serve to set the scene and will help us focus on the importance of multilingualism in a crisis setting. The video was prepared by the Association the Slovak Association of Sign Language Users with the help of Slovak Sign Language interpreters who welcomed refugees coming from Ukraine during the early days of the war. So, welcome back. So I'm sure you will agree with me that this was a very insightful account, which will also help us to uncover some of the items which we will touch on in the next hour. So you could see in the video, talking about challenges, technology in crisis situations, and also lack of financing, which is another challenge. But I'd like to move into now the discussion, and we often hear talking about crisis translation. We also yesterday heard our dear friend and colleague Tatiana Struk talking about translating in a crisis, and she mentioned many of the challenges and in such a critical context. But I'd like to now hear a bit, and I'd be curious to hear from Sharon and Stella here. So is it possible to define crisis translation? I mean, what does crisis translation encompass, as Anya was early, asking?
Should we go over to Sharon?
Oh, thank you. Thank you, Lucio, and good morning, everybody. This is a really good question. How do we define crisis translation? I would say that it's really difficult to define. It's an evolving concept, and Federico and I have really used it as an umbrella term to cover a vast range of translation activities in crisis settings. I think it's important to acknowledge that there is the field of crisis communication that pertains to business and reputation management as well, but this is not the area that we have focused on, although it involves translation as well. So when we talk about crisis translation from our research perspective, it's not really covering that business reputation management side. One of the big issues, I think, for us is that the definition of a crisis or an emergency or a disaster is not really agreed upon in any case in disaster studies and disaster management field. So that makes it even more difficult to define what crisis translation is about or how it differentiates itself from other overlapping areas of translation, and whether we're talking about professional translation or volunteer or amateur translation or both of those. But I thought it might be really useful to maybe present you with one of the definitions of a crisis coming from disaster studies field, which I think presents to us many of the features of a crisis as we understand it. So that definition is that we speak of crisis when a threat is perceived against the core values or life-sustaining functions of a social system, which requires urgent remedial action under conditions of deep uncertainty. So there are a lot of things there that I think that speak to what a crisis is, a threat. It's something that goes against our normal social system. It requires urgent remedial action, and there's a lot of uncertainty. Federico and I have talked about crisis translation as something that should be looking at multilinguistic, multicultural, multimodal, and multidirectional communication in the context of this kind of crisis. Because these crises really, they widen existing vulnerabilities amongst communities or create new vulnerabilities due to miscommunication or indeed non-communication. And this is really predicated on the assumption that information is aid. And we need timely, accurate, clear communication in an accessible language and format in order to ensure aid to those who need it. From our perspective, translation and interpreting have been overlooked as prospective tools for providing aid to people. And I think I'll finish with this, that the other thing that we need to be very much aware of when we talk about crisis translation, sometimes we think of it as just translation and interpreting as response or immediate response to a crisis. But actually, we really need to consider the role and the strengths of translation and interpreting in the other phases of crisis, in recovery, in preparation, in mitigation. And I think that that's also something that has been overlooked. Thank you, Lucio.
Yeah, thanks, Sharon. I will just follow on from Sharon to say, what she said when we're talking about crisis translation. I can offer maybe more of the practical, operational side. My organisation is Clear Global, Translators Without Borders. We heard yesterday from my colleague Tatiana, who gave us that inspiring keynote speech. When we talk about crisis translation, what do we mean? We're talking about many different scenarios. And to be honest, when I think about, the only characteristics that the crisis translation has is maybe the domains tend to be similar. You know, we're looking at similar domains. And the other aspect that is always the same is that it is fast moving, it is dynamic, it is changing quickly, and we need to be ready to respond, to adapt, to innovate, to see what the individual characteristics of each crisis bring. And so, crisis translation as a term, it doesn't really encompass everything that my organisation, you know, what we do, and also what we seek. We seek to raise awareness around this idea, the importance of language. So, crisis translation, I would say I have worked for my organisation for over 4 years. And I would say that every year I have overseen the deployment of language services for 2 to 3 different responses. And that's included health emergencies such as the Ebola outbreak or COVID. It has included natural disasters such as the cyclones in Mozambique a few years ago. Right now we have the floods in Pakistan we're responding to. And then we also have conflicts, northeast Nigeria, we're operating there. We also have our team on the Ukraine response. And every time it's completely different. And it is not just translation that we are doing. We are expanding our service offering. We are trying to see what are the needs of the people, what are the needs of our partners, and then to adapt and advise accordingly. So, in fact, that's actually my organisation, which many people still do know as Translators Without Borders. We actually decided to change our name to CLEAR, which stands for Community, Language, Engagement, Accountability and Reach, basically to try to show that we don't just do translation. You know, it is so much more. It's very relevant for the theme of this event, actually going a translation beyond text. So, yes, the other area we really try to focus on is what Sharon mentioned as multimodal, multi-channel, the idea of two-way information. There's no point us broadcasting information to people if it's not what they need and if they don't understand it. So a lot of the work that we do is around really trying to understand what the needs of the affected populations are, and then to try to get them that information so that we can inform our partners and make sure that the information we are providing is relevant. And the other aspect, which I will just add, which is very important, is which languages, right? When there is a crisis situation, which languages do we need to address? Unfortunately, in the past, mistakes have been made which have had serious consequences because assumptions were made about the languages that were spoken by affected populations, and information was put out in major world languages thinking, well, that's going to be sufficient. Actually, I'm referencing the Ebola outbreak in West Africa in 2014. Unfortunately, in the affected areas, I think only 10% of the population actually understood French or English. So that's a massive, massive mistake. And since then, lessons have been learned, and that's something that my organisation also tries to help with. finding out from day one what languages do the affected populations understand, what language do they speak at home, how do they like to receive information, what format do they want to receive the information in, is it radio, is it television, is it in person, is it via community leaders. So basically it's all of these things, and when it comes to translation, it's not just translation. In low literacy contexts, written information is useless. So it's audio translation, it's pictorials, it's, we will talk about it later, technology, language technology. How can we use language technology? So it's big.
Thank you very much, both Sharon and Stella. I think I would summarize maybe it all with what Sharon was also saying: multilingual, multimodal, multidirectional, and multicultural language use, basically. I really liked what you said also, Stella, about, the two-way information and picking of, the relevant information, and also the strategic use of languages and the mean, of course, in this context. But, we were talking about challenges, and I'm sure there can be, various more challenges and at different levels. But I'd like then to hear from the audience first, and I'd like then to call for the very first slide or question, which I will read out aloud. In the context of humanitarian human rights crisis, what challenges do you believe language professionals face? I will repeat the question. In the context of humanitarian human rights crisis, what challenges do you believe language professionals face? So we can see already people say lack of resources, which, also our friends in the video at the beginning was referring to, lack of time, speed, stress. That's an important component as well, an important challenge. Emotions, for sure, and how to deal. Yesterday, Tatiana talked about how to deal with emotions. Security and safety, that's another challenge, another good one. Trauma, vicarious trauma, especially for interpreters. Neutrality, that's also an interesting one. Lack of context, that's very translator, right? Translator-oriented. And deadlines. So I think it gives us already an idea what our audience thinks the challenges are. So I'd like to then move to our panel again and hear from Gaia and Federico in particular. So the question is now to you. So in the context of humanitarian human rights crisis, what challenges do language professionals, and they say language professionals, as Stella was saying, it's not only about translators, it's not just translation, but also Sharon was saying, was interpreters and other, intercultural mediators, face in ensuring that essential communication flows and reaches the people in need. So, Gaia, would like to go first, please?
Thank you so much, and thank you for having me. I'm really sorry I can't be there in person. The logistics didn't work out. So first of all, I think I love the theme of this, because I think the challenge is already in the theme of our session, that we have to go beyond text. And I think the first thing is really to understand this is not just about taking text or messages from one language to another. And Clear Global actually has the strategy. And Clear Global Translators Without Borders actually helped my organization to operationalize this belief that we should be working with the needs of the community that is most affected and the most vulnerable within that community. So we have to understand in humanitarian and health emergencies, vulnerability is not homogeneous. Some people are more vulnerable than others. And in fact, translators help us venture into this area of crisis and outbreak communication. So just in the first 6 months of this year, We translated nearly 9.8 million words into more than 60 languages just for health emergency response. And we've definitely gone beyond national languages, UN languages. So, for example, we have Ebola material available in not just Swahili, but Swahili that's spoken in Kenya, Swahili that's spoken in DRC. So we really are, this is not about translation, it's about making sure that the most vulnerable are able to not just receive information, but communicate. So we know in health emergencies that there's more uncertainty, more vulnerability, and much more opportunity to exploit. We know this. There's usually, there was a good definition of what a crisis is. I look at it that there is a hazard, there is exposure, and the capacity of the local situation is exceeded. So you need help from outside. And this means an influx, a massive influx of people into areas. And they don't necessarily understand the context, they don't understand the culture, and they're very single-minded. Results first, we must save lives, we must stop a disease, we must do this. So this results focus pushes us, that time and results pressure, to stop considering things we would normally consider. In a somebody's house for dinner, we would take time to understand what's going on, what the people there want to, what their norms are. But in an emergency, we take our norms and our standards and we rush into communities, often with an elevated sense of almost a God complex that I am here to save and serve. So I think this, we lose humility and context in an emergency. And but there's also less resources for the most vulnerable, and there's less safety for them. And I think for translators, professionals, the first thing, the challenge they face is that in order to understand locals, and the best translators are in the community. And so how the work that, for example, Translators Without Borders has been done to prepare that and to have profiles of what languages are spoken and where the resources are, that's really, really important. I think my experience in health emergencies, and I agree with the example of West Africa, where many, many mistakes were made, that not only deciding what languages we need, but really understanding this message-based communication doesn't work. There is no way we can say, here is the message, and you translate this into local languages. So in Ebola West Africa, the main message in all the posters around West Africa was Ebola kills. And when people have seen this, hundreds and thousands of posters, and we expect people to now bring their sick to healthcare facilities, they refuse, because if Ebola kills, why would I go and die somewhere strange without my loved ones, where my body will be incinerated and I cannot even have a funeral? So we lost that whole context understanding. So I think I agree with everything that was said. Even though there is a time pressure, we do have to do the preparation work to understand context, understand language, but also find who is the most vulnerable. Now, my current work is in preventing sexual misconduct, and we're talking about sexual exploitation and abuse of affected communities by response workers, including our own personnel. And this happens because of the massive power differential, the opportunity to exploit, sex for jobs, sex for money, sex for food. And so I'm in this space where we need to now do translational communications on very sensitive topics, which adds another dimension. So how do you go cold into a community and basically say, if our responders demand sex from you, this is wrong and you should resist? This is a very difficult conversation to have, even in a long-standing relationship. So I think, so these are the new challenges that we are seeing. On top of saying, here is where you can get food aid, here is where you can go to a hospital, this is why you need a vaccine. We are really looking at accountability to communities. How do we do no harm? How do we protect? And some of the concepts and values don't translate so well. So I think these are really, really important. So listening, dynamism, being willing to change, being willing to and able to pick up on concerns that are not voiced. So often the problems are where people have no voice. Accessibility is a problem. Research that says, oh, everybody wants to use text messages, or they prefer, you know, some sort of internet-based communication. But we have to understand, particularly in emergencies, people have to make a decision between food and bandwidth, right? Everything, even if we give it as free, has a human cost. So I think these are some of the issues I've seen coming up. But I'm really, really encouraged that many organizations, and based on the pioneering work that's particularly done with Translators Without Borders and others, are beginning to at least be brave enough to enter this space of uncertainty, complexity, to say that it should not be transactional, but our objective is to use translation, suite of multidisciplinary interventions to save lives, to reduce suffering, and so on. So I think trans professionals should also think of the big picture. Why are they doing this? Who are they doing it with? They don't have to do it by themselves. They don't have to be perfect or right. So I think professional translators also have to come into this space of uncertainty and vulnerability themselves. So I've gone on for a bit. Maybe I stop now. Is that okay?
Thank you. Thank you very much, Gaia. Very, very interesting points that you raised. The importance of preparing, study the context, picking up on the concerns that are not voiced, and the importance of having professional translators coming in and maybe coming in with a different perspective and helping out in doing what also the community translators do to reach out to the community. But Federico, I will hand it over to you now.
Yeah, thank you very much for having me here. And I would like to pick up straight from where Gaia left off, which is what she was describing is a new sense of advocacy for the importance of multilingual communication. So beyond the translation, beyond the text, because we need to go beyond the expectation that a single message can help. Multiple messages are needed, as Sharon was saying, multiple channels, multiple modes. I want to pick up on that because we could see also from the opening videos that this element of advocacy faces major challenges when we come to talk about collaboration and resources. And I think the call for additional collaboration from the Slovak Association in the opening video is a reminder that to achieve that flow of communication, we need to invest in resourcing some languages. And that doesn't happen overnight. I think going back to the experience of the World Health Organization and Translators Without Borders in the last decade, what is emerging is that language is a social determinant of health in ordinary conditions. In fact, the United States Center for Disease and Control mentioned linguistic diversity as an issue to have access to healthcare in ordinary context. So when everything is fine, then imagine when a crisis erupts and you need support from outside. So I want to go back to the Ebola response of 2014, because I do have a few pointers to share with the audience that come from the experience of YMCA Sierra Leone. There was one of the exposed local NGOs that supported the response to the West Africa Ebola in 2014. And in 2020, they contacted me because what they didn't want to happen was a repeat of what happened during the Ebola. They wanted to move beyond the text. They wanted to move to a communication that would reach the multilingual communities that did not speak English, that did not have access to culturally appropriate information in 2014, and they shouldn't have been affected, according to YMCA, again, by the COVID-19 pandemic. So as part of a project that was initiated by Pius Mana there at the YMCA, we tried to develop resources. And I think one of the most challenging aspect that Gaia pointed out as well is the best translators are the translators that come from the local population. But often the local population doesn't have any form of training for translators, for interpreters, for intercultural mediators. And that could be okay. If we have strong bilinguals, something can be done. But if those bilinguals don't have access to dictionaries, resources of any sort, let alone multilingual resources, and they're already deciding between food and bandwidth, how can they support multilingual communication that is efficient in a crisis? So with YMCA, we worked for over 9 months to create just a standard glossary that could be a point of departure to discuss hazards and natural hazards that have an impact because of the climate emergency that we're all living as a planet. And one way of dealing with that was to try and encourage the translation of essential concepts that we all refer to in English, which are not transparent as they sound, but they were used to, on one side, inform public messaging around the pandemic, which is one of the natural hazards, and on the other side, trying to educate to be better prepared, more able to have community-based responses to both public health, so responses that matter for the community, that can be understood by the community and that can be effective for the community. And on the other side as well, using local knowledge that goes beyond the knowledge imparted by a government that may be speaking a language that is a colonial in origin, a language that doesn't come with trust, and that was the case and is the case in Sierra Leone. English is spoken by a very, very small minority, highly educated, normally institutional figures, and then many geographical areas depend on other languages for communication. So the Sierra Leone project reminded me of how challenging it is to develop these resources when you have no websites available in Limba to create a glossary, you have no dictionary, paper or otherwise, and you have no formal training of professionals in any context. So that was one of the projects that I wanted to mention, because it touches on that big issue of creating preventative measures. That comes with collaboration, that comes with resources that are often not there. And I wanted to move to another example at the opposite end of the spectrum, one that I had the opportunity of evaluate as a project that was funded by the European Union, by the Directorate General for Integration and Community Care for Asylum and Refugees in Emergencies, where the local community may have the capacity to react, because this project was based in Italy, so I hate these definitions, but a developed country, a G7 country with economic resources and capacity to deal with public health issues more than Sierra Leone. But the iCare project, that was the project funded to support asylum refugees to have access to standard healthcare emergency, has drawn on the notion of collaboration and made it the center of multidisciplinary training, providing training from professional translators and professional interpreters and intercultural mediators to bilingual migrants who speak languages that are not normally taught or used in Italian training environments, be they academic or professionals. And the iCare project has developed a form of training that involves also a response to what the audience was saying. How do professionals deal with the stress of interpreting for forced migrants who've been subject to all sorts of torture, abuse, sexual abuse, violence? And how do interpreters and intercultural mediators can cope with the associated, the vicarious trauma that come from that experience that they are mediating for the migrants and for the medical personnel? So they've created a very interesting form of training that involves representative of migrant communities from refugees and asylum-seeking backgrounds that are involved in training medical personnel to see what they need to know, what they want to know. And they involved also psychiatrists, psychologists, and professional interpreters in training intercultural mediators and members of the migrant population to operate in this context. This project started in 2017, and of course, you will all imagine where I'm going to end up. Come 2020, the pandemic erupts. Well, the IKEA project was especially well suited to respond to the pandemic. And what I'm trying to find out in the next few months is whether we can see a correlation between the very small number of mortalities and morbidities across the migrant populations served by the regional health authorities who were part of the IKEA project, where the very much lesser number of people hospitalized from migrant background compared to the local residents of the region served by the same health authorities. So in fact, migrants who are exposed, additionally vulnerable, suffered less of the impact of COVID-19 in Italy, in the regions that offered them additional information, better access to information than the Italian population themselves. So I think this tells us about the need for not only developing that collaborative approach, but also to look at the message that works for the population that needs to receive it. And so that particular approach also led the IKEA project, for instance, to consider simplified Italian as one of the resources to help also speakers of Italian themselves who may not have found access to information about first mitigating measures around the pandemic and then about vaccinations easily accessible. So I think I wanted to point out these two extremes because they both tell us about the need for collaboration and the need for prevention and the fact that these do not happen overnight. They need investment, they need a long-term objective. And I want to close with just one observation that builds on the idea of training. With Sharon and John O'Shea, who's the chair of the European chapter of the International Federation of Translators, the FIT, we've been surveying professional associations in Europe to see whether training is offered to professional interpreters, professional translators, intercultural mediators to develop the skills to operate in crisis context. The findings of the initial piloting survey will be disseminated pretty soon before the end of the year. But the reality is, as Gaia was saying, as Stella was saying, as Sharon was saying, a lot of focus is on the response phase, but you cannot respond if you don't have the resources, the glossaries, the people to do so. And I think I end there.
Thank you very much, Federico. Very, very interesting and, key points that you raised. Importance of training, but training for also to be ready for the before the crisis, there is a crisis outbreak, and also a kind of different training, which is a multidisciplinary training. Terminology, you touched on terminology, which is essential. We have to also maybe think or see things with different, eyes, not with the Western global North eyes, coming from university and, terminology would be understood by every user, but we have also to understand different contexts, and sometimes those terms are not created or not intelligible maybe or they do not even exist because they're not the reality of this the would-be users. So also a lot of preparation there and the study of the context, as Gaia was saying earlier. I'd like now to maybe ask a question about, we have talked about technology a bit, but sometimes the technology, especially in a crisis setting, can be defined as a double-edged sword, I would say. So let's imagine, for example, machine translation. The immediacy of the message versus the quality of the output. I don't want to, of course, now raise concerns about that. But how do you feel? And I would like to hear from everybody. How do you feel about it and its impact in your field, in your work? Both in your research, but also, maybe, you also, Stella, you have very practical examples, and Gaia, but yeah, would you like to go first this time?
Sure. Okay, so technology for us, I think one of the first things to remember is, as Gaia pointed out, connectivity. So in many of the scenarios where we've been working, connectivity is a major, major problem. So that immediately creates issues when we're talking about technology, language technology, In fact, our glossaries that we put out, just to mention terminology again, we do a lot of work on terminology. The glossaries that we make available are actually offline enabled, and that was so that to aid workers in the field would be able to download the glossaries onto their phones so that they are able to actually use them. So that's one aspect. The other aspect to technology, when we, especially in my work, is that language technology, we've heard a lot about language technology, and it's always really fascinating, interesting. I love language technology. However, my organization that tries to focus on the most vulnerable people, we actually talk a lot about people who are marginalized by the languages they speak. There is no language technology for them. So we're talking about, maybe around half the world's population speaking as their mother tongue languages that are not readily available on Google Translate. So, they go out to the restaurant and they can't just, translate their menu. They find themselves in a crisis situation. They cannot use the same tools that we are used to using to get support. So we do a lot of work around, and collaboration, actually. We touched on collaboration before. I think that's a really important element of our work. A lot of collaboration. Crisis situations, just to look at the good side, right? Crisis situations, often it's a lot of quite depressing stuff, but it brings out the worst in people, obviously, the crises sometimes, but it also brings out the best in people. And that leads to some really interesting cooperation and collaboration efforts that wouldn't actually be possible otherwise. Within the context of COVID-19, we worked on a project together with big tech companies, academic institutions, where we were developing data sets for low-resource languages, specifically for content, COVID-19 related content. And that is all publicly available, on GitHub, downloadable. So these are really exciting projects. We're also developing our own machine translation engines for low-resource languages. But we also really want to focus on real-life use cases. How can we use these technologies? Can they be used when we're talking about low-resource languages? Can the raw machine translation output for low-resource languages be used as it is? We're working on another project right now with a big tech company to try and see if that is possible. We're evaluating the output of the raw machine translation engine in Kanuri and Hausa, languages of northeast Nigeria. There's all sorts with language technology. I will just add one more point, which is to, again, remember the two-way element. And what is exciting about language technology is it does allow us to listen to people. We can use machine translation to automatically translate interview transcripts that would never get translated otherwise because there is not the funding, there's not the resources, there's not the time. We can use machine translation to at least get the gist, to identify trigger words, to try and understand what is being said. Do we need to prioritize this? Do we need to investigate further? So these are really good uses of machine translation. And we can also use language technology more widely in chatbots. Everybody loves a chatbot these days. So within humanitarian contexts, we worked on developing chatbots for COVID-19 in the Democratic Republic of Congo and also in northeast Nigeria. The first multilingual chatbots in local languages, including Lingala, Congolese Swahili, and it's really interesting because working together with using information from the World Health Organization, from reliable sources and the International Red Cross, we were able to listen to people. So depending on what questions people are asking, we can then identify information gaps. We can identify potential sources of misinformation, and we can feed that back to our partners who can then update the content, upload the new content, and we can create a loop of information where we're giving the people what they actually want to know. So these are really exciting projects that we're working on. Speech technology as well. We are trying to do work with low resource languages for speech technology, looking for real use cases so we can actually use it. And we do have some projects ongoing in that area as well. So yeah, I'll hand it back to you, Lucia.
Thank you very much, Stella. And I was taking note, I mean, connectivity. I mean, I have the feeling that, you know, I would summarize what you say, that also technology, of course, is key, essential, but if not used, you know, in the right way, it could perpetrate inequalities, inequities in society as well. Also, I'd like to also touch on, you know, the two-way elements. I think it's very interesting, and you know, if I understand correctly, you were saying that also technology could be used as a listening tool to then target the message, basically, that we were discussing about earlier. So I'd like to go to you know, our colleagues online. I don't know if Sharon, Gaia, I mean, who would like to go? Yeah, Sharon, please.
Yeah, briefly, I would say, because Stella has covered a lot of the points there. There's a lot to say about language technology in the area of crisis translation. So maybe to cover some points that haven't already been mentioned. When we talk about language technology or translation technology specifically, people's minds often go straight to machine translation. And of course, there is a use case scenario for machine translation, which we'll come back to. However, there's also a use case scenario for the more traditional translation technology tools. And again, this comes back to the point of, if we take our minds, or rather broaden our minds a little bit away from just response to crisis to recovery, preparation, mitigation. Those are different kinds of contents that need to be translated in those scenarios. You know, you've got training, you've got insurance costs and how to claim them. You've got, you know, building specifications and how to ensure that you're not creating a building that's going to collapse in an earthquake. So there's lots of different content that might need to be translated in crisis settings, that where, you know, computer-aided translation tools like translation memory, terminology management tools actually play an important role. And this comes down to maybe looking at the use of machine translation, which, of course, if you're uninitiated, you might think this is the perfect tool for crisis response. If you know about machine translation, you would say you couldn't possibly use it in crisis response because it could lead to somebody losing their lives through inaccuracies. So we need to really look at what content are we translating with these tools, and looking at it from a high risk, low risk perspective. So some content is very high risk if it's wrong, and other content is not so high risk if it's wrong. So we really need to consider those aspects as well, which of course speaks to machine translation literacy. And this is something that we've seen lacking in COVID-19. With some governments just purely posting raw machine translated output on their websites about vaccinations and so on, and hoping that people will understand it. And I suppose they think that they were doing well because they were including lots of different languages. But, you know, what if the information is incorrect? What if it's culturally inappropriate? So knowing how and when to use machine translation, I think, is a really important skill in this field. So I'll leave it there. We can come back to, there are other things to say there, but I'm sure other people want to get their speak in there as well.
Thank you, Sharon. So I would maybe summarize it with the importance of classifying, categorizing content in terms of risk, urgency, and maybe cultural appropriate one as well. So Federico or Gaia would like to add something? Yeah, Gaia, please. Thank you.
Yeah, just jump in. So there are associated technologies, not just technology for language, right? So this all works together. And I have personal experience of always being not marginalized by language, but definitely on the sidelines. So my native language is Sinhalese, immigrated to the UK. As you can see, I'm not a native English speaker. You know, back to Sri Lanka, where I'm now a foreigner because I've lost the command of my own language. Then I go to China. I'm Chinese, so Geneva, and my French is awful. I have a great on the sidelines of this. But there are other issues, generational issues. I'm not a digital. It's effort for me. Technology, never mind language technology. I'm a woman. I'm part of the group that represents 75% of the global health workforce. But women are the least empowered. They deliver health. They don't have access to technology. They go for training during crisis, after crisis. So I think, we really have to think about that. Technology related just for direct communication with communities, but we have very complex emergency responses with hundreds of organizations. Helps coordinate responses better as well. I think we shouldn't forget that, because we are the middleman between what needs to be done and communities, So that kind of preparation we talk about, not just the use of technology, but the why of technology, the how of technology is super important. A couple of examples: in the 12th Ebola outbreak in Northern Democratic Republic of Congo, the area was very inaccessible. You had to go 12 hours by motorcycle to reach it. I think this was the 11th or 12th. I'm sorry if I'm wrong. And I remember this language spoken there, because we had started thinking about this before. We knew it was Lingala. I think we worked with Translators Without Borders. We translated our Ebola package into Lingala, and we transmitted it using technology. So the local responders had the basic package on how to protect themselves and the basic initiating conversations with community before the international assessment team reached the place. I mean, this was just, I was so thrilled, because when I started in this work, we did not think of this. But what we did is we have now integrated under risk communication, community engagement, and also health operations, the need to have translated material, right? Even if it's just to start off. And that's part of our SOP. So I think it's really important not just to say it's important, but to do the preparedness, put it in standard operating procedures, resource it, technical resources, but it takes a lot of money. I think we have to understand it's one of the most expensive elements of our work now, because Zoom is free. We can say it's almost free, right? But interpretation, even into UN languages, costs so much. So we really need to look through this. And I just want to go back to a point that Stella talked about misinformation. So one of the defining things in the COVID response, communication and translation, was related to what we call an infodemic. That there is so much information that people really don't know how, what to listen to. And there was a very strong vaccination campaign. There were on that was uniform across all countries. It wasn't particular to one community, and it was basically based on mistrust. And so we use technology and language technology to do that listening. We do this together with UNICEF, IFRC, and a lot of work was about listening and not talking, but listening, and then coming up with strategies to see what we could do to address this. And I think going forward, there is a trend towards mistrust in authority, any authority, from a doctor to a government, any authority. And so I think translation is also going to be very, very important. As Frederico said, it wasn't just language that people in Sierra Leone and Liberia and Guinea didn't listen to the messages. They felt if it came from the powerful, speaking this colonial language, those in power, it cannot be right. We should not listen. So there's a very big political dimension to this as well. So as you can see, I'm not very informed about language technology, but I understand that it's going, unless we address this together, we are going to face a lot of roadblocks. We may have the resources, we may have professional translators and interpreters, but this is trust, politics, generation, the marginalized. Unless we look at it as a comprehensive package, technology could be a very dangerous tool. So technology is there for us to use, not for technology. We should not be driven by technology, but we have to drive technology beyond the transactional.
Thank you, Gaia. And I like how you close your intervention. Really, we should drive technology, not be driven by technology. And the collaboration point came through very clearly from all of you. So, Federico, would you like to very briefly add something?
I think this would normally be Sharon's part, but technology is one of the tools in the toolbox. So we've heard as a triage technique or as part of other communicative efforts. It doesn't establish trust on its own. So technology as a standalone solution doesn't work. But in the hands of those who are aware of the cultural and the linguistic and the political and the social dimensions, then it is an effective tool. Standalone, no, but let's consider it in the broader perspectives.
Thank you. Thank you very much, Federico.
Thank you very much, Lucio. I hope my microphone is on. That's great. I've appeared on stage, which means we're going to do the Q&A, but can I just add to that? Not from a translator's point of view, but you were talking about Ebola, and I was filming in Mali in 2014 on the border with Guinea during the Ebola outbreak. I was doing a film about meningitis vaccine, but all the posters, it was in the health centres, there was no written words anywhere, it was all pictorial. So even I understood what you had to do. I didn't speak the local language, and it wasn't in French either. So it was extremely accessible, actually, to everybody. We've got quite a few questions coming in. I'm hoping to take some from the floor as well. But the first question that's come in, which has got the most votes, I can see you there, I'll come to you in a minute, is emergency situations will arise more and more in the next years. Do you think we need to develop emergency crisis response as a translation speciality? I'll start with you, Stella, as you're here.
I'm not sure that I'm the best person to answer this since we have two academics on the call, but it already is a speciality with Sharon and Federico doing a lot of groundbreaking work in this field. So there are already universities offering these courses. But yes, absolutely. I believe that the things that we have touched on today definitely do warrant the need for this, and the lack of training, which is what we have also talked about. The lack of training is a major issue. We saw that Tatiana talked about it in relation to the Ukraine crisis yesterday. The fact that in a country that has a lot of professional linguists, so they were there ready, the translators, the interpreters, but they were not prepared to deal with the situation because they had never received training on the humanitarian field, on the terminology, and perhaps most importantly, the emotional aspects, the vicarious trauma. So I would say yes.
Thank you. Well, let's go to Federico first then. We mentioned there about the courses there. What's actually on offer in terms of courses and emergency responses?
So within the academic sector, training translators and interpreters, both Dublin City University, University College London, and also University of Auckland in New Zealand offer introduction to crisis translation to both, in our case, public service interpreters and translators. To answer the question with a short answer, yes, we do need a centralized system. And to add a detail there is an interest from professional associations to explore what can be done. So I think, yes, training, but it's not just academic training. We cannot forget that these institutions I mentioned will not necessarily be able to operate with the languages that are needed in the humanitarian context, in the sectors where lesser used languages are needed. So the training that we offer, for instance, focuses often to the non-language specific, non-specific combinations. It's a training about dealing with the communicative needs, dealing with the emotional side, dealing with the urgency of operating quickly. And we need to develop more that kind of training. And on the very last note, we know that some professionals receive training on how to deal with operating in stressful conditions. No training is perfect, but firefighters, police forces, emergency services receive some training. Well, probably some of that training needs to be embedded in professional translation and interpreting, as well as in intercultural mediation.
Interesting you say that, because actually there is a question about should there be some kind of psychological support and training. I just wanted to go over to you, Sharon. Did you have anything to add?
Well, just really briefly, to build on what Federico said, yes, we have this module that we offer on our master's programs. I'm not sure we would call it a speciality per se, but what we're trying to do is to ensure that our translation studies and translation technology students could act as language advocates in NGOs and international organizations who are involved in humanitarian response, for example. In our case, we open this also up to our students who are on the MA in refugee integration. So we have a lovely combination of translation technology and refugee integration students together. And of course, you get really interesting synergies going on there. So this is how we want to see the future. We want to see people who are involved in these kind of response situations who are very savvy about communication in general, multilingual communication, who can make the case for that and for responsible use of technology as well. So we're aiming towards having graduates who can do that, but I'm not sure we would call it a specialization really.
Thank you very much. And Stella, just coming back to you there, is there any kind of psychological check and support for people going into these situations?
It's definitely an area that needs work. I mean, many of the NGOs, they make available a lot of resources for psychosocial support. But again, we're talking about preparedness, and this is one of the major issues. We have translated a lot of these materials into many languages, with conversations, strategic languages. Which languages should we translate this content into? Oh, let's do it into French, Spanish, Portuguese, Arabic, the major pivot languages, so that when a crisis happens, at least we've got the main pivot languages covered. Then the Ukraine crisis happens. We had nothing in Ukrainian, Russian, the relevant languages. So, and that material is still being translated now because it's big. there's a lot of stuff. So we are actually delivering content on psychosocial support and training now into the relevant languages for the Ukraine crisis, from February. So the funding, the resources, the preparedness is a big blocker in general to the work that we do, and it is really, really needed.
Thank you. Of course, there was a lot of discussion about cultural competency, and there is a question here which I'd like to put to Gaia. Gaia, your internet connection is a bit unstable. Let's hope this works. Do you consider the cultural connection being of the same culture between the translator and the parties in conflict an advantage or disadvantage?
I think it can be an advantage and a disadvantage. I think it depends. Again, answer is it depends. But it's not about one culture or the other. I think, in the previous question, that orientation about how to understand a context, how to work in different contexts is very, very important. You do find when the interpreter or the translator is from the same culture, sometimes they do gatekeeping. They translate according to their own understanding and their own norms. And particularly in the area that I'm working in, sexual misconduct, you will find it's usually men, and they would translate in their own head what this means. So I think the more, having several people, different perspectives is useful, but it's very difficult to pick one over the other. We should know the risks and benefits of each.
And I'll just add my point of view there again as a filmmaker, having been to many developing countries, particularly in Africa, filming some quite sensitive subjects. And the translator on the ground has added their cultural filter, shall we say, on some of the interviews that have been given and then going back to the edit suite and getting it translated again, and it says something completely different, and having to completely change what I thought that the interviewee was saying. So the output was a bit different. There was a question on, yes, want to press the microphone?
Hello. Hello, so my name is Veronica Barbeta. I'm representing here the University of Alcalá from Spain. And you just mentioned before that translating and interpreting during a crisis is not just during a crisis, it is also before and after a crisis. So, because we know that every crisis has consequences. So I have a question for Stella. So in Clear Global, do you have a follow-up strategy for vulnerable groups like you've worked with before? So do you have a follow-up strategy for afterwards, after the crisis? Thank you.
Good question. Yes, at Clear Global, we're working together with other organisations. So we are, we're a middle woman, middle person. So we are working together with all the various coordination groups and the various organisations. But in every crisis response, the preparedness, obviously, if the crisis happens and we've not done the preparedness, that's gone. So, but we can, after the initial months, generally what happens is we have a very intensive time at the beginning where it's understanding what the needs are, setting everything up. And then as the crisis response moves into a second phase, or indeed a third phase, and a fourth phase, where you're starting to look at the more long-term effects. An example could be, again, if we look at the Ukraine response, where we're already started to think about the future phases, and it's more about host communities or people moving back to their homes after the initial migration away. So there are various things. The other thing to mention, which I feel is important, and is a big challenge actually, is an exit strategy. So when we go into an area, and again, this is like all humanitarian response, you go into an area, but at the same time, what happens when the crisis is over, the funds have gone, and everybody just goes back home. So in our case, and this is actually something we are working on right now, is to try and understand what our exit strategies should look like. We have right now, for example, our teams in Northeast Nigeria and Bangladesh. We have worked hard to build up resources in local languages, train translators and interpreters in local languages. We're talking about areas where there isn't really the language service landscape that we might recognize here. There might be a few translators, but very few translators in local languages. So what happens when we leave? We don't want all that work to go to waste. So we need to find ways to make sure that once we're gone, that the work that we have done does have a future, so that all the research, and the training and everything does get put to good use, because the crisis isn't going away anytime soon.
Thank you. Well, we're running out of time, so I'm going to hand over to Lucio to wrap up eloquently.
Thank you very much, and you will have the opportunity, of course, to meet us then, to talk about this further. So maybe I'd like just to go for the last slide or question. So what is your main takeaway from this session in one word? Just let's hear what you have, retained. And
while we're waiting for that, I'll just do my signposting messages now so that you can go and have your lunch quite soon. So just to say thank you so much, and can you be back here by 2:00 in good time when we're going to start again, when we've got 3 more panels this afternoon, shorter ones and really exciting and really dynamic. So I hope you will come back and enjoy that, and also enjoy your lunch. The words are coming through. Lucio, what do you spot?
So I can say preparedness, for sure, crisis, challenge, preparation again, so inspiring. But I think preparedness is the one. So maybe very quickly, Stella, what is your one word from our discussion today?
Well, for me, it would be awareness around language. That's more than one word, sorry. Awareness around the importance of language issues and the role we can all play in that.
Yes, so very quickly, Federico. One word.
Mine would be collaboration.
Gaia?
Don't be transactional, be transformative. Understand why we are translating.
Thank you. Sharon?
A phrase, if you'll allow me, fast mobilization requires forward planning.
That's great. Thank you very much. I think that's a beautiful summary of our discussion today. So I'd like to thank all the panelists. I learned a lot myself today, and I think it's the same for all of you. And I'd like to thank also our audience. I hope you enjoyed our panel, the organizers, of course, and last but not least, the Slovak Association of Sign Languages Interpreters and Sign Language Users, and Martin Tadian, who helped with the subtitle, who is a student from the Department of Translation Studies at Constantine Philosophy University in Nitra. So, grazie mille, arrivederci.
Yo voy a dejar aquí las cosas. Vuestras tarjetas las dejo aquí por si alguien las quiere robar. Sí, ¿no? Así como venga.